And now to Nigeria, where the Japa syndrome, which is a local parlance for Nigerian youths trooping out of the country in search of greener pastures, I would say en masse, to foreign countries, is the new order of the day. Without exaggerating, I have at least one friend relocating to other parts of the world every single day. And this has been a concern for a while because as people are moving, it's weakening the various sectors in Nigeria in terms of replacement, in terms of training new people, and being short-staffed. But that doesn't stop anyone now from finding green pastures, does it? However, Abebe Selassie, the director, African Department, International Monetary Fund, IMF, has said that the Nigerian government can take advantage of the Japa frenzy. Surprising, right? Well, it could benefit the Nigerian government through investments and, of course, through remittances, which he said has become important to African countries. So we're going to find out how by having this conversation and, of course, with our guest. Joining me on the show to discuss this is Olanrewaju Adewole, Principal Consultant, Point of View Consulting in New York, all the way from New York. Thank you so much, Olanrewaju, for joining us.
Thank you so much. Thank you for having me on the show
It's a
to
pleasure to have
discuss
you
this
join us.
topic.
All right.
Yeah, thank you.
Starting from the most obvious, right? Let's talk about the reasons why we have such high rate of brain drain. I'm talking about it has so degenerated to the point where in every hospital you have one doctor to 6,000 people, 6,000 patients. That means we've lost a lot of doctors. I wouldn't say lost, but a lot of doctors have, gone in search of greener pastures. Why exactly do we have that high number of brain people moving to other countries?
All right. Thank you again for Blessing for inviting me over to
Of
talk about
course.
this matter. Yeah, we all know this is a crucial matter, brain drain. The word brain drain itself is a very crucial matter. And the reason behind brain drain in Nigeria is multifaceted. And but I'm going to highlight um, a couple of significant factors, that caused it. So if you look at let's just use the healthcare sector as an example. You see that if you look at it, inadequate healthcare infrastructure in Nigeria itself, it plays a crucial role. It's automatically, if I'm a doctor and I can't even do what I know how to do best because the infrastructure is not going to help me achieve what I'm going to do. I'm going to end up like have somebody dead, like a patient dead, because there's no infrastructure. Maybe there's light goes off and all that. So if you look at this part, the doctor to patient ratio is like 1 to 6,000, just like you said. That's overwhelming. It's automatically going to burden on the healthcare workers. It will lead to burnout, limited career growth. You know, no, just like I said earlier, also scarcity of medical equipment, poor working conditions. I don't know if you've been to like the medical facilities, like especially government owned. You'd be surprised. Also when they talk about medication, lack of essential, not ordinary, paracetamols and all that. We're talking about like essential medication, for high blood pressure. These are like almost hard to get, you know. So if you also look at um monthly income, I know some doctors that get paid like 100,000 naira, a month for a doctor after like 6 7 years of training and all that. So this automatically, how would they even cater for their family? And they see their peers in the US, in the UK doing well. They automatically have to look like, you know what, I need to find a way to Japa, just like you said, they want to Japa. And if you look at it, even the 100,000 or 120 or 150K they are being paid is not even regular, So they could just wake up and they say they're owing them salary for 3 4 months. It doesn't even make sense. So when you get to that point and you know that there's no career progression, no opportunity for progression, automatically you want to leave. And that's the honest truth. And if you also look the other part, which is the main part of any society, is the political and social instability. It will automatically contribute to brain drain. You know, I've seen in the news, I've seen the medical association striking. It's unheard of. You know, many years ago, one of my uncle died because the doctors were on strike because he was driving from Lagos to Jos, and he had an accident, but the doctors were on strike and he died. The children are they are their orphans now, you know, which is sad. So automatically, a doctor gets to that point, is under that pressure, is not getting paid properly, infrastructure is not good. Automatically, it leads them to have no choice than to leave. So also, if you look at this other little part that we can call little, is look at our teaching hospitals. Some are one of the best in the 90s, but look at it right now. You know, research, all those things for researching is even almost impossible. You have to go to like private unit to be able to achieve that. So it gets to a point that people get to, you know, I wouldn't blame them to want to leave for better opportunities.
Right.
And that
Olanrewaju, I
is the
mean,
problem.
obviously,
Yeah.
these reasons are justified, and it's good enough that they want to find greener pastures. And of course, it's leaving behind a lot of these challenges that can be surmounted. But now they're saying that the brain drain that's having doctors move, you know, an exodus movement of doctors to other parts of the world can benefit us as a country. How is that? How can we turn this around to our benefit?
Well, true. You know, I'll call it the Singapore approach. You know, you get to a point, it actually can help. And the easy way for you to help is when we have brain drains, like we have like doctors move to maybe like UK and US, you know, they they often face fewer restrictions. And now they don't get that enough research back home. So they can get to the US and learn one or two things, new things, you know, collaborate on use of technology with international experts, you know, access to like state-of-the-art technology, you know, they even engage in advanced training programs. With such exposure, it can help them become more knowledgeable and equipped to address the healthcare challenges in Nigeria when they return. That's if they return. You understand? So another thing is remittances. You know, there's a research I conducted, you know, a while back. That 2022, that Nigerian living abroad they remitted for $19.8 billion back to Nigeria through all those platforms. So automatically, it's going to help the economy grow too. Because, you know, when I'm abroad, I know how much I want to send home, you know, want to send to brother, sister, whatever. So it's thereby boosting the economy because I'm pumping in the dollars, quote unquote. So, but however, it is important to note that the benefit of brain drain should not just overshadow the need to tackle the underlying causes. So Nigeria must make it a priority to improve healthcare infrastructure, offer better working conditions, you know, and also address the issue related to retaining skilled professionals. That means you have to increase their salaries. It is very, very important they need to increase their salaries. And automatically, when you're getting paid properly, good dollars, infrastructure is good. So what else? Why do you want to Japa? You know, the word Japa, you know?
Right,
That's
and I
my
like
take
how
on that. Yeah.
you say Jackba.
Yeah.
It's good. I mean, it's good that you mentioned that the main aim is to get them to stay. I mean, of course, it's the idea is so they don't leave in the first place. And with all of these measures that you have you know, highlighted, I think the question will be, what is the guarantee that that will work? Because now the federal government is talking about foreign direct investment. will that be the solution? If we get this investment and they're investing it on infrastructure facility, which is good, but like you said, not exactly prioritizing the salary of the staff, that's the doctors themselves, because even if we have all the equipment and facility and good infrastructure, if these doctors are not well fed, they will still leave. So I think the question will be, are we prioritizing the medical personnel enough?
To be honest with you, thank you for that question. To be honest with you, it is very, very important. Doctors, like medical practitioners are very, very important. Look at the COVID period. They held it down especially in Lagos. They held it down. We need to increase their salary. It's very, very important. We need to prioritize them and make sure they're like very important, just like the way it's done in the West. But to the question you talk about guarantees, that this approach will work, like for people to the people abroad to be able to come and invest. So if you look at it, we need to create an enabling environment that promotes entrepreneurship. That's one. Job creation, skills development within Nigeria. Once we address that, because now when you are engaged, probably if you look at Rwanda, the youth understand engagement. Some are doing internship. It's really hard for you to say, I'm not saying there are no Rwandans abroad, but it's really hard. But because there's something they're engaged to do, not just like only just party music. If they are engaged by events, when I mean events, entrepreneurship, government is promoting, just like the YMCA of the United States. That helps a lot. And if you look at entrepreneurship, when I talk about entrepreneurship, I talked about, if you look at the United States, especially New York, they promote small businesses because small businesses is the life of any economy, no matter how small they are. You understand? And that is very important. Additionally, we need to invest in education. It's very vital for building knowledge-driven economy that can compete anywhere in the world. Just like, if you've seen some videos in China, how the children, they promote, hands-on, not just only about talking, it's about hands-on. I've seen some videos of some African countries where, they are teaching them how to use computer just with mouth. So we need to promote this. So once we promote education, because that's where the government is needed. When we promote education, entrepreneurship, skills development, then I think we've done major part of it. And we need to create an enabling environment for people who are Japa, because when they Japa, they find out that, oh, this is not what I actually thought. So they can actually come back and impute all the knowledge they gathered back to the economy and the society. So that's my take on that.
All right, fantastic. Thank you so much, Olanrewaju Adewole, for helping us discuss the Japa syndrome, like you mentioned. Thank you so much. Principal Consultant, Point of View Consulting, New York, all the way from New York. Thank you for joining us on the show.
Thank you. All right.
Pleasure. Well, this is where we call it a wrap on Village Square Africa. Stay tuned as the news comes up next, and don't forget to join us for other episodes of VSA as we discuss issues trending across the African continent. Till then, I'm Blessings Mosugu.